this man have a speech impediment?
All right. I started the
Like,
recording. Whatever. We'll
okay,
just go. Okay.
you
Welcome
can
to.
always do
Yeah.
redo the introduction later.
Yeah,
Okay,
but I'd rather not mess
go
with the
go
audio
go for it.
file. It's just so annoying. So,
Okay, you go.
welcome to the Two Doctors and a Dummies podcast, where we talk about random stuff with my siblings who are doctors. So, they will explain to me medical terms, and then I will listen quietly, asking questions along the way. The first topic is going to be gout. So, how about we'll take it away with the scenario of I have two friends and acquaintance who have had gout. It was really interesting to listen to them talk about their little struggles about being able to walk, or in one case, my friend was trying to boulder while he was working with gout, and that did not worked out too well. So, yeah, let's go over. A guy comes into the office, Sia, or Cheche, and then that's so weird. I don't know what to call you, but I guess I'll call you Cheche, and then
You can say Doctor Sister, and then
Doctor
you can say
Sister,
Doctor Brother.
Doctor Brother, Doctor Sister. Okay, and then I'll be no doctor, no doctors.
That's true.
I'll be Doctor Computer.
No, you're supposed to be the dummy, so
Yeah,
you're like Doctor Dummy.
Doctor Dummy. Okay, I'm just thinking about a crash test dummy with the stethoscope. Okay. Yeah. So, take away if you wouldn't mind, like explaining to me like the basics of gout. Well, like, so yeah, we'll just start with like, what is gout?
So, gout is a medical condition that affects a joint, and there are some medical conditions that people like kind of use freely, and they say, "Oh, I have this." Like people say, "Oh, I have bipolar disorder," and really is not diagnosed as often. In general, when people are diagnosed with gout, it's usually pretty accurate.
Hmm.
So, gout, in the medical term, there's multiple types of gout.
Okay.
The most common is an accumulation of, or rather, like a collection of uric acid crystal in one particular joint.
Hmm.
And it's usually that base of that big toe, only on one side. For some people, it's in the hand. Some people, it's rarely in the knee. And it's usually in a smaller joint rather than a big joint like a hip or a back. So there are certain things that make people more likely to get it, like being hefty, being a dude,
Mm-hmm.
certain genetic things, those things you can't control.
Hmm.
And there's also things like diet. That's a huge one. There are certain foods that make you more likely to get that. So if people have a huge surge of like a feast that has things like seafood, alcohol, a lot of meat, like people might have at a holiday party, or like a seafood broil. And then afterwards, they'll have this like sudden joint pain, and it's excruciating. Like even having your bed sheets laying on top of that joint is extremely painful.
Hmm. Okay. Question. So, when you're talking about the diet, is it something that somebody eats and then later down the line the body produces too much of these uric acid crystals, or is it as like, I don't know if that makes sense, to eat it and then it immediately goes into the joint? I'm not really quite sure how to phrase that question. So,
I think it's hard to know just because we don't get really good data
about the types of food.
on the consistency of like the intake of a single person on seafood
Oh, okay.
compared to their alcohol intake, compared to their like 16-ounce beefsteak, 32-ounce beefsteak intake.
Hmm.
But we know that at some point, as somebody who has a generally high consumption of this, and then within a few days, they'll have this manifestation of a gout flare up. And the
Hmm.
flare up, like the gout flare up means like it hurts for a period of time, And then after a certain amount of time, a few hours, a few days sometimes, the flare up, as in the pain and the swelling, go down.
Mm.
But that particular joint, at some time in the future, can flare up again. So it's not a forever condition, but it's more of like, oh, this. Once I've got it, my body can do it again and again and again.
Mm.
Most people have flare up of gout anywhere from 1 to like 6 times a year, just depending on how they control it. Some people make massive changes and they only ever have one in their life because it was such a bad experience. But those are super disciplined people.
Mm.
But some
So,
people try to do their best and it still happens.
mm. So, like, I guess, can you talk a bit more about like the uric acid, the details of the uric acid crystals? Like, how do those form, and is it a little bit of coincidence or unluckiness that it gathers in a particular joint? I guess. So there's like two questions there.
The answer is we don't know and yes.
Oh, okay.
So gout is an affliction that only, as far as we know, only affects humans.
Mm.
We have not seen gout or gout similarities in any other animal, either with uric acid or any other kind of crystal formulation accumulation in a joint space. Joint space being like the space between two bones where there's usually like fluid floating around
Mm.
to keep your joints moving smoothly. And that's where all the crystals float up. They don't hang out on top of the bones or inside the bones. It's like the little fluid pocket that's around where two bones join. So people have figured out that uric acid is made in the body from like just normal breakdown of parts of the body as it's working. Certain medications cause people to not get rid of their natural uric acid, which usually people pee it out.
Mm.
Um,
To me,
and
that conjures images of of like urine like build up in the joint, which I don't think that's quite the same thing. That seems a bit ridiculous.
no, yeah. So urine is actually blood.
Oh, okay.
It's all the waste products of blood.
Oh, okay,
And that's
okay.
exactly what the kidneys are. So the kidneys have a lot of blood flow to them. And then
Filter.
all the crap that needs to, like old blood and like waste products, just stuff that you don't want to keep, the kidneys just say, oh, we're going to dump this and we're going to put it in this trash can. And then at some point, we're going to tell boss to go dump the trash can.
Mm.
The trash can being the bladder.
Mm.
And then boss going to go dump the trash can means peeing. So, and then poop is, food.
All the
And then pee is blood. And your body gets rid of other stuff like other ways, like skin. We shed skin and we shed hair and we shed the lining of our intestines, which gets mixed in with the poop, like all kinds of funny waste products. But urine is very specialty. And so the fun thing about urine as a way to get rid of just old stuff like uric acid is the whole medication standpoint. Because if you take medications, you can change what your body dumps.
Mm.
And so that's the main mode of a bunch of medications, is to try to get you to dump it in the urine, or to try to like sometimes even like bind the uric acid so that it doesn't accumulate into crystals, because crystal formation is just something wholly different. And that's how they diagnosed gout to begin with, is like, hey, this joint is swollen, let's stick a needle in it, suck out the fluid, which is kind of gnarly,
yeah.
put it under a microscope and see what's on it. Are there bacteria? Are there viruses? Are there worms? Is there something else? And then when they put it underneath a microscope, they saw these crystals.
Mm.
So in general, when a joint is inflamed, it's called arthritis. So some people call it gout arthritis.
Mm.
Because arthritis just means joint
so this
inflamed.
Is pure theory crafting. I wonder if it's like gout is some sort of idea where, for some reason, the body makes a tiny mistake about like where to put the urine waste, and then, but that I don't know if that sort of kind of follows, or if that's
Yeah,
a little bit too much.
nobody knows quite why this has happened.
Mm-hmm.
Huh. Like I said, humans are the only ones that seem to have any kind of gout, which is a crystal formation in the joint.
Mm-hmm.
The purpose of uric acid to begin with, nobody knows. It could be just like, oh, just completely random that we make these and they happen to crystallize
Mm.
and they happen to just hit in one joint rather than multiple joints. Nobody exactly knows why.
Okay, so kind of speaking of going back to like the ideas of medication, uh, the medications that like alter your waist, you were talking about that, and maybe Dr. Brother, you could talk a little bit about this too. Like what type of medications would alter your? I guess it would change the consistency of your urine, or like so. Okay, and then maybe thinking a little bit more about the whole gout idea, would changing the medication in order to change your urine help, or maybe associating urine with gout is probably a bad idea. It's more about uric acid. Is that correct? So
Yeah.
okay, so I guess my curiosity is like, let's start with the gout part first. What types of medication would clear through this gout problem a little bit quicker, or address the symptoms of gout a little bit quicker? And this is, I guess, an open question to everybody.
Well, always first off is see if you can do lifestyle changes. Lifestyle meaning change your diet. Well, change your diet, drink a bunch of water. Um, if
Reduce.
you have like a medication that's causing it, is it safe to remove it? Because those things are cheap and easy to do. And then once you start a medication, it can get really expensive. So that's always kind of like a second line. Once you get to the medications, then yeah, that can get complicated, and as medications do.
Mm.
Yeah,
I
it's
didn't
essentially,
answer the question about the medications, but I'm just laying that background there.
yeah, essentially lifestyle changes that don't require medicine changes.
Okay. So, okay, actually, why don't we start by addressing the common symptoms? Just let's list them out. So you're saying, is it, you said it was a type of arthritis, so that's like an inflammation of the joint, and then what other symptoms would there be? Is it really just that, or um,
Yeah,
although I
so
guess
it's
that one is quite strong in itself. Go ahead, sorry.
yeah, it's usually sudden onset meaning when's it start. So people will just be living their lives and then suddenly they just get pain at one particular spot.
Hmm.
And then let's say it happens on their big toe on one of their foot. Just pick one side. They're like, oh, did I hit my foot or something? And people are confused because it hurts extremely badly.
Hmm.
Then they take off their shoe and take off their sock. Then they see the base of their big toe is red and mildly swollen, and they touch it, it feels warm.
Mhm.
Because there's a lot of blood flow there and a lot of fluid there. And then they're usually hobbling. They don't, whenever they're hobbling, they don't feel any like clicking or cracking or like leakage of the skin. It's just like red and swollen. And then, um,
So would an
when
anti-inflammatory?
people see some, no, when people see that, they all usually automatically thinks like, oh my goodness, my foot is infected,
Oh,
or
I
I
see.
hit it and I injured it in some way. And so if they think that they injured it some way, some people would just say, "Oh, I'll just tough it out and it'll get better." And
Hmm.
if people have the mindset like, "Oh, something bit me like a spider, it must be infected," then they go to the ER, and the ER will diagnose them with gout.
Hmm.
Yeah,
Sorry, what was your question again?
Well, I
it's
was thinking about the anti-inflammatory, but Dr. Brother, if you wouldn't mind your comment first.
yeah. I was just saying, like, as for how it looks, I mean, it's just really swollen
Mm.
generally, versus like something that just looks only mildly swollen. In this case of gout, it does look very swollen.
Is it almost cartoonish how swollen it is? Like if whenever you in a cartoon
It
like
can
a
be.
carpenter hits their thumb with a hammer. It's like that big and it's like blinking
It
red.
can be, yeah.
Okay,
Yeah,
well,
it can be.
well,
Yeah,
For
it's
some
like
people, like it's very subtle, and then for some people, yeah, it's quite obvious.
hmm,
it's not something like like say if you get a mosquito bite, it may be like a swollen bump or something like that, or something that you become allergic to mildly. But this is more on the a little bit bigger scale.
hmm, okay,
Yeah.
okay. Well, I'm kind of going through my notes. I guess, yeah, you were talking about the ER. Like, how common is it that an ER, or just I guess, is this gout uh, affliction happening with people? Like, does it actually happen more often than we think? Oh, I guess anecdotally, I've had 3 friends, coworkers who, in my past 5 years, I've kind of known and be like, oh wow, you have gout? What? So how
Yeah,
common
it
is it
is. It
compared,
is
let's say
quite
compared to a
common. Yeah,
flu or something like that, or something? Well, the flu is obviously
I
too
would say
common.
it's not. It's not as common as flu,
Hmm.
but it is still common. I
So
don't know the exact numbers on the top of my head, but it
mm,
is common that
okay,
everybody's going to meet a couple people in their lives that have it.
so it's not gonna be a rare thing where a doctor's gonna be like, what is that? And then they have to do some Dr.
No,
House stuff
doctors
in
are
order to
pretty
figure out
aware.
what's going on. Okay.
Yeah, no.
Okay.
It often isn't uh misdiagnosed as something else.
Mm.
Like I said, there are certain conditions where people are like overdiagnosing it as this when it's actually something else. But in gout, it's usually pretty obvious for doctors. The main thing that we have to make sure that it's not make sure that it's not is like an infection, because if it's is an
Mhm.
infection, you're quite sick, but the person's usually sweating versus just like whiny. It which is hard if somebody's really stoic, but
Uh-huh.
that's why unfortunately sticking a needle in it is something that like the us healthcare professionals are trained of, like, hey, when is it safe to stick a needle in it? When do we just take an x-ray? When do we just test the blood to see if there's an infection process versus, because always when you stick a needle in a joint, do you think you're poking the beast and going to cause a full-blown massive infection if you like poke an abscess and then the whole body's going to go under? Or sorry, I'm
Mm.
going into like quite the rabbit hole,
Yeah, that's
but this is
fine.
just like the first, like when the patient first gets into the doctor's office and the doctor's kind of gauging is like, oh, this is something that's what we call self-limited. This is something that's treatable, or this is something that, oh, you need to follow up with somebody, or you need to go upstairs to get a room in the hospital. That's all in that first few minutes face-to-face encounter, um, when somebody seeks help.
Okay. So let's go with a scenario that the
Oh
patients
man.
come in and we figured out it's gout. So how long from that point do you think it's like until the gout kind of dies down and becomes, on average, for most people, how long does it usually take to go away? Maybe for that instance of flare up, is it
So
usually?
for the first instance, I don't remember exactly, but my memory would be just a few days. And
Mhm.
when somebody gets more familiar with their gout,
Mm-hmm.
they're able to jump on things a little bit more quickly, and sometimes for them it only lasts a few hours before they get it under control
Mm.
through medications and just like taking it easy, like nipping it in the bud. But for
Okay.
that first flare up, yeah, because it's all the uh the nerve, the senses in the joint are just extra sensitive. The immune system doesn't know what to do with itself. Oh, there's something has spider webs.
Hmm.
Okay,
I think spider webs in the joint would be a big problem.
that would be a big problem.
Mm-hmm.
That's called a
Um,
parasite. But I don't think there are uric acid spider webs out there.
that would be something quite interesting. Okay.
Yeah, that'd be a case report.
So looking through my notes, so we've kind of gone through what happens, how to kind of prevent the symptoms. I guess that's mostly a diet and like um, change and what causes it, which is the uric acid crystals. So,
Hmm.
I wonder if there's really anything else that like we want to chat about this. I think that's fine right there. We'll Okay, we'll probably just end it right here. Uh, okay, stop recording. 3, 2, 1, bye.